Some of the common occurring conditions with PTSD include clinical depression, various forms of anxiety disorders. Alcohol and substance use disorders are another big category, and we also have a number of personality disorders that tend to co-occur with PTSD, including borderline personality, avoidant personality, and dependent personality. And with everything, we try to treat each of the clinical problems not only individually, but also look at how they occur together and try to treat them as a holistic picture. And for somebody who's coming in with PTSD and other co-occurring conditions, as almost everybody does, we have to make sure to address both of the clinical issues or however many there are in the picture. But oftentimes we recognize that the PTSD occurred first. And so if we think about PTSD maybe as the origin and perhaps presenting as a risk factor to some of these other clinical conditions, then we want to make sure that that PTSD is holistically addressed while we have them. And so we try to make sure that we expose them to a number of different therapies that could be helpful. The research shows that it's not really a one-size-fits-all, so that even though there's certain techniques that seem to work with individuals with PTSD, that certain different people respond to things differently. And so we want to make sure to expose them to a variety of different techniques that are known to help individuals with PTSD, and also help them to develop more insight about why this trauma is continuing to impact them in this way. Not every single person who has been through a traumatic experience develops PTSD. So we also talk about resilience, how to build resilience, how to build protective factors in your life so that when these symptoms come back up, you'll have a way to combat them.